Hello, I'm Dr. Richard Pitch, the Medical Director at Oakdale TMS. This brief video is a review of the Oakdale TMS outcomes data, intended to share with our healthcare colleagues and also with patients who are seeking relief from depression and anxiety. We hope the information here will educate you about TMS therapy for the treatment of depression and anxiety. This data presented was peer-reviewed and accepted for presentation at the 2014 Clinical TMS Society annual meeting. We report on three groups of patients: those with severe and extreme symptoms of depression, those with more moderately severe depression, and those with both major depression and multiple sclerosis. We are one of the few centers in the U.S. that has treated a severely treatment-resistant patient group and reported on the results. As you can see here in this pie chart, over 76% of patients had severe to extreme baseline depressive symptoms when evaluated using the Beck Depression Inventory. This patient population tried, on average, more than 9 medications to treat their depression, with many not finding relief from as many as 15 different medications. This is considered to be a very treatment-refractory group of patients with a heavy burden of symptoms. The good news is that with TMS therapy, over 60% of these patients had significant improvement, and more than half of them gained complete remission of their symptoms. Our patients with more moderate depression, based on the Beck Depression Inventory Scale, had a 71% response rate and a 71% remission rate, which is significantly higher than that of the more severely ill patients. As expected, patients treated earlier in the course of their depression responded better to TMS, but both groups did better than they would be expected to do with yet another trial of medications. We have learned from the STAR-D study, a large study on the use of antidepressant drugs for major depression, that the likelihood of achieving remission declines with each successive medication attempt. For example, those that have failed to respond to a first-line medication treatment have about a 22% chance of remission with the second treatment attempt. Subsequent treatments further decline in efficacy to less than 7% after 3 drugs have already failed to produce a remission. We have also learned from the STAR-D study that the likelihood of a patient dropping out of treatment because of side effects rises dramatically, nearly tripling at the second level, which is one prior drug failure. So with each subsequent medication attempt, the odds of getting to remission get smaller and smaller, and the odds of having troublesome side effects get higher and higher. This is why it is so important to consider switching to another method of treating the depression, such as transcranial magnetic stimulation, to break the cycle of treatment failures and treatment intolerance. Our outcomes data show that even with severe symptoms and prolonged treatment failures, patients can still get well again with TMS, and that has been immensely satisfying to see and a privilege to be a part of. We also presented our results for anxiety patients. Half of these patients had at least a 50% reduction of symptoms on the GAD-7 scale, and nearly 40% enjoyed a full remission of their anxiety symptoms. We are also the first to report on the use of TMS to treat patients with major depression and comorbid multiple sclerosis. We treated 3 patients with TMS therapy. All 3 had remission of depressive symptoms. The 2 with comorbid neuropathic pain syndromes had substantial reduction of their pain as well. There was no reduction of orthopedic type pain. 2 of the 3 patients were weaned successfully off of their antidepressant drugs. There were no harmful or beneficial effects seen from the TMS on the course of multiple sclerosis. In our follow-up 2 years later, one of these patients still remains in remission from depression and off of antidepressant drugs. The second remains off of antidepressant drugs but does have mild depressive symptoms. The third is still on antidepressant medications. He had a subsequent relapse of depression 9 months later, which again responded well to a short reintroduction of TMS therapy, which consisted of 4 sessions over a 2-week period. In summary, our results show that TMS is a highly effective treatment for those with recurring depression, even among patients who have been failed by multiple antidepressants in the current episode and throughout their lifetime. The track record for its safety and tolerability is outstanding. Treating patients early in their current episode of depression with TMS therapy will likely have a greater outcome than continuing with the next medication trial. TMS was effective, safe, and well tolerated in 42 consecutive outpatients. Our data also shows excellent efficacy in utilizing TMS therapy in the treatment of anxiety as measured with the GAD-7 rating scale. We were the first to report in the United States treatment of patients with major depressive disorder and comorbid multiple sclerosis, with excellent results for the depression and no added burden of side effects or safety issues from the multiple sclerosis. We would welcome you to call to find out more about TMS therapy and about us. You can call us at 631-563-3162 or visit our website at www.oakdaletms.com.